This is another session, another beautiful session of the Health Hub Show, and I'm your host, Nyambura Kamau. But before we proceed, I want to remind you, usisahau, whenever you need plumbing materials, whether you need sinks, whether you need showers, whether you need toilet seats, they are here for you. They are located along Kubukubu Road, just next to Blue Line. So this is my guest here today. Najua anakaa familia, mshaimwona mahali. Nataka atukumbushe jina, anatuko wapi, because we are in a very special place.
Thank you very much. My name is George Kahu. I work here in this office called Mount Kenya Heart and Cancer Center. We are in Embu, opposite the governor's office.
Okay.
Yes. So we mostly deal with cancer and heart diseases and the condition that bring those heart diseases like diabetes, high blood pressure, and we do have our partners, cardiologists, those are the doctors who deal with heart diseases, and oncologists, those are the doctors that deal with cancer.
Wow, yeah. That simply means you don't have to go to Nairobi kutafuta hospitali. When you're in Embu, they are here just for you, Cindy.
Yes.
So, Daktari, I want us to talk about something. Problem yenye imekuwa ikiarise about coronary artery diseases. What are those and as in affect aje?
So the coronaries are the blood vessels that supply blood to the heart.
Okay.
So in as much as the work of the heart is to pump blood, for it to be able to work, it also needs oxygen and nutrients. So the coronary arteries are those blood vessels that supply the heart muscle itself so that it can be able to push blood to the rest of the body. So when we talk about coronary artery diseases, we are talking about conditions that affect those blood vessels.
Okay.
Yes.
Wow. Now, what are the causes of the coronary disease? Like the causes, like the main problem?
The main issues, they are acquired, so it's not something you're born with. So mainly diabetics, hypertensives, people with high cholesterol or mafuta ya damu, smokers, people who live a sedentary lifestyle, those people who don't exercise at all, and also people who are obese. They are at high risk of getting those conditions of the heart vessels. Yes. So
the main cause, the main cause, it's a risk.
It's a combination of those things. So someone who is hypertensive is at a higher risk of getting coronary artery disease than someone who's not. A smoker is even at a higher risk. So a diabetic is also at a higher risk. So those people are the ones who tend to get coronary artery disease. By the way, these are the conditions that we or the lay people call heart attack. Oh. Yes.
So in heart attack in short.
In heart attack, whether it's a small or a big part of the heart that is affected.
Oh, okay. So I have a question, that is.
Yeah.
How does it develop? Does it go with stages ama siku moja nitaamka tu nisikie niko mgonjwa?
So it happens with deposition of bad cholesterol or blood mafuta ya damu. There are those which are beneficial and there are those which are not. And we tend to retain the ones which are not. So they start getting deposited on the blood or those blood arteries or those blood vessels. So they can build pole. And then if the blockage is big enough, what happens is that you will start getting symptoms. And there are those that actually occur at once. So the building of that bad cholesterol in the blood vessels has been there, but one morning or one day, it decides to burst. And the way our body is created, once there is an injury, we form a clot. So there is that cholesterol in the blood vessel, then it will burst, then we will form a clot and block. Yes. And those are the ones that tend to take people to see their God.
In heaven immediately.
Yes, immediately.
Well, what are the common symptoms, like besides sasa hiyo erupt at once?
Yes.
Are there other symptoms?
So, number one, chest pain.
Okay.
And this chest pain, most of the time occurs when someone is doing an activity, like walking upstairs or a hill, and most of the time it occurs in the middle of the chest.
So
most of the time, I have not said it cannot occur on any other part of the body, but most patients experience, some even describe it as they feel like an elephant sitting on their chest.
Oh, okay.
So it's very, you get chest tightness, chest pains, especially when you're doing an activity. Yes.
So does it also affect by age? Like unaweza pata mtu young haizi pata hiyo shida, ama old get it more?
Yeah, the age matters because the older generation are the ones who have these conditions, like diabetes, hypertension, and the like. So it mostly affects the older generation, but it doesn't mean that it cannot affect young people.
Is it also affected by the way you eat, ama your lifestyle?
Very much. That's why I talked about smoking. Lifestyle is key. What you eat is key, because the kind of food we eat also determine whether we are going to build those bad cholesterol or the bad blood, mafuta ya damu ile mbaya yenye inaendanga inafanya nini, those vessels to be blocked. So lifestyle is very important. Smoking cessation is usually what we recommend as the first thing. Number two, exercise is very important. Number three, the diet is also very, very important. Yes.
Can it be corrected or treated?
Yes, and time is of the essence. In fact, the heart specialists say time is muscle. So the faster you get into a hospital that can correct it, the better for you. Sometimes up to 24 hours is the best window, but it can be corrected even after that.
Oh, okay.
So what is done, okay, there are some medication like what we call aspirin and cholesterol lowering medication. So if you're in a situation like a place like here where we don't perform surgeries or those things that can tell us which exact vessel is blocked, then we will start you with those medication, and then you'll be sent to Nairobi, because Nairobi, Eldoret, and Mombasa, and I think Kisumu nowadays are the only places where you can get those services. Then the doctor will go check which vessel is blocked, and then it can be unblocked either by putting unblocking it. There are ways they do it. It's too technical, or surgery.
Oh, okay.
Yes, where your heart is
taken out.
It's not, it's not taken out, but they will open it, and then they know which part is affected, and then they will bypass. It's called coronary artery bypass graft. Yeah, so it can either be surgery or that other way that I was describing. So
if maybe I have that problem, I'll only take lightly. Maybe I get a short-term treatment and just leave it at there. What are the risks that I'll be in besides them?
Your heart muscle will fail, or your heart muscle, the part that is blocked, means that there is no blood supply and nutrients going to that area, to the area that is supposed to be supplied by the blocked artery. So the muscle tends to die off. Oh. So you can get what we call heart failure. Yes. So,
okay. The blocking, it only happens around the heart or within the heart? Need other blockings in other ways of making?
That's the problem with this condition. These blockages can happen anywhere. Actually, that's why we have this thing there. Because you can have a blockage in your brain. The blood vessels that supply your brain. Unasikianga mtu alipata. Yeah, unasikia mtu alipata stroke. So technically, this is a blood vessel.
Okay.
And we have blood vessels in each and every part of your body. So, what we are discussing today, we are only discussing today about this blood vessel that supply the heart. So it can get blocked here, so all this heart muscle dies off. Or this one can get blocked here, this heart muscle dies off. Or it can go to your brain.
Okay.
And then the blood vessel supply in your brain get blocked.
Oh, okay.
And then the part that is being supplied by that blood vessel dies off.
Okay.
Unasikianga mtu alipata nini? Stroke. Or it can go to your kidneys.
Okay.
The part that is being supplied dies off. You end up with kidney failure. Even your eyes can be affected. And even your lower limb or miguu. Kwa sababu there are big vessels there. There are people who tend to block. And then what happens is that they even get amputated.
Ooh.
Yes.
Well, thank you very much for moving on with us. And I hope you are enjoying the show. Najua mjaiona part of the heart and part of the body. Well, that is good to hear and that is good to know. We are going for a short break, so don't move, don't go around. We will be back shortly. But before that, I would like to remind you again, Pelezi Hardware, they are here for you. Whenever you need plumbing materials, they will give it to you, whether in retail or in wholesale. Also, whether you need sinks, showers, or toilet seats, they are here just for you.
Angwenwa wende kuongerera mathomo maku Sukuru wa Management University of Africa mai ava gukuonia mwerekera mwerire wa September mwaka uyu maina intake kothire cia certificate irongorerwe ni entrepreneurship, ICT, counseling, psychology na cienge nyenge na cionthe cie kwambiriria min grade ya D Prime. Wina min grade ya C Prime kana C minus no ukorwe ugeka diploma courses ta diploma in management and leadership, diploma in supply chain management, wava muwe na diploma in international relations and diplomacy. Na twa ogwo tu maina nginya kothi cia undergraduate programs ta iria niyo bachelor courses na kiria urendekana nuwa min grade ya C+ wanakana ukorwe na diploma kuma sukuru wesikene. Kothi cia masters ititigitwe na vuva amune tondo maina masters in business administration, masters of arts in development studies, masters in management leadership, wana ongienda gweka PhD courses maina kothi ta PhD in management and leadership wava mwena PhD in business administration. Duka riganirwe mai wana professional courses taka SNEB, French, NEC na sienge nyenge kogwo ndukewe wina thina aditondo maina online classes na physical classes. We mwena wa Mount Kenya no wiki kothi sietu asukurure wa Achievers College Embu. Nwao makore main campus, Kisaju off, Kitengera Road, Kajiado Road, Nairobi campus, Berview, South Sea, Popo Road off Mombasa Road. Kana umavurire thimo kuri namba kivugo mugwanja imwe ithano ithathatu igiri imwe kivugo ithano ithatu kana niyo 0715621053. Email yao niyo rodieki@mua.ac.ke kana umakinyire website iri yao ire niyo www.mua.ac.ke. The Management University of Africa, enabling future, impacting progress.
Welcome to Kirimara Opticals Limited, duka la miwani kwa bei nafuu. We are the people who care for your eyes. Start your journey with our free computerized eye checkup. providing you with the most accurate prescription. Step into our world of frames. Discover a stunning collection featuring top brands like Sissy Boy, Guess, Bavino, Katia, Ripple, MCAT, and Eden. Whether you're looking for a classic look or something bold and new, we have the perfect pair waiting for you. Enhance your vision with our state-of-the-art lenses. Protect your eyes with blue block lenses from digital screens. Experience seamless visions at all distances with progressive lenses and enjoy clear near and far sight with our bifocal lenses. Kirimara Opticals Limited. We are here for you. Even when your glasses need repair, our expert will have them looking and feeling like new. Visit us today at Embu Town. We are at Wanjiru Center, Kubukubu Road, or call us via 0722939379. Also, we are at Embu Meru Highway, next to Mbuni Dry Cleaners, CBD 0708064062. Meru Town, we are next to Family Bank, during Cheke Street, or call us via 0722943183. Nanyuki Town, we are at Oasis Plaza, number 5, Lumbumba Road. Call us via 0701163335. Nyeri Town, we are next to Naivas Supermarket off Gakere Road, or call us via 0721535420. Isiolo Town, we are at Kirimara Opticals Limited, 101 Plaza Guest House. Call us via 0719269270. Email us at kirimaraopticals@yahoo.com. Kirimara Opticals Limited, the people who care for your eyes.
Welcome to Minor Highway and Highway Court Hotel, where comfort meets convenience. We pride ourselves in offering top-notch conference facilities, perfect for your business meetings, seminars, and events. Our state-of-the-art conference rooms are equipped to cater for all your professional needs. Enjoy a refreshing hot shower in our self-contained rooms, each featuring modern amenities and a comfortable setup. For your convenience, we offer lift lodging facilities, making access to all floors easy and hassle-free. Indulge in our delicious snacks and savor the flavors of fresh seasonal fruits and vegetables. Quench your thirst with our freshly squeezed juices made to order for your enjoyment. Book with us today. Call 0722-827-700 or 0722-831-226.
Welcome back, and we are proceeding with the show. This is the Health Hub Show. But before we proceed, let me remind you again, whether you need septics, whether you need plumbing materials, Pelezi Hardware, they are here for you. They are located along Kubukubu Road, just next to Blue Line. So, Daktari,
Yes.
Are there other means? Okay, are there other means of treatment besides surgery or seeing a doctor?
Okay. Okay. There's some drugs which someone can be given, but within a very short period of time. So what happens in our setup is that people tend to come when they are already advanced. Their condition has advanced.
So medicine is not a permanent solution.
Yes, and also even after surgery, or what I was calling, we call it angioplasty, whereby they go and they open up without having to cut,
Your hand.
yeah. They go through your blood vessel from here or from here at the leg, and then push something. It goes, and that blockage is opened up, and a small wire mesh is kept there to hold the part that has already been opened up.
Okay.
So it's called angioplasty. That is one of the ways of treating it. And then the other one is that issue I was talking about, surgery. But those who advance, for example, they go to a level where they go to heart failure, or their rhythm of the heart is distorted, they can be put even some machines which are called pacemakers, which help with keeping the heart, helping the heart perform its function, and also helping it when it is getting better.
Okay.
Yeah, but medication, patients will be on medication throughout
Their
whether
life.
you have been done surgery or you have been opened through what I was talking about, angioplasty, or whether you have those two machines, you will be on some medication. Yes.
So, in short, after you get a treatment, it's still not a permanent solution. Haiwezisha completely.
It's a bit, because especially in our setup, we tend to go to the hospital a bit late. You remember when we were discussing about this issue, I talked about time is muscle and time is of the essence. So most people will come after 1 month, 2 months, maybe when they have already gone into heart failure, when they start feeling other symptoms, maybe miguu yao imeanza kufura, wanahema sana wakitembea na hiyo uchungu. That's when they will come. But in other developed world, people are so aware. There has been a lot of education, the public. You find that even people will understand that I am getting a heart attack and rush to hospital.
Okay.
And that is the best time to have the best solution. But still, you still be on medication. But you may not be on as many medication compared to the other person who came late. Yeah, and even the way your treatment or your management is scheduled is not the same way as that person who came late.
Well, when we talked about risk factors, we talked about obesity.
Yes.
It's a risk factor, right?
Yes.
So, if a child is obese,
Yes.
the treatment measures, are they the same with an adult's treatment measures?
Children should be made to do all those things that we advise people about lifestyle. We are in a space where we are giving our children a lot of junk.
Yeah.
So kids are getting crepes, they are getting chips, they are eating a lot of pizzas. So they become obese of a preventable issue, especially due to our lifestyle and our meals. So it is important to encourage our children wasikae kwa nyumba all the time watching TV, playing games on the phone. They are not exercising. They are not like when we were younger and you'd wake up in the morning and go outside and play with your friends until night.
Yeah, true.
Inabidi mama yako akuja kuchape.
Kirudi hadi uonekani.
You see, the kids of this generation are not getting that kind of advantage. Even the places that we live, we don't have enough spaces,
Yeah, true.
social spaces and all that. So we find our children are really sitting down a lot, watching a lot of TV, and at the same time when they are watching that TV, they're indulging in junk food.
Yeah.
So they tend to be obese. So we should encourage them to eat the right food, fruits, vegetables, proteins, reduce on our carbohydrates, and then exercise.
Oh.
Yes.
So then they cannot have this problem, this disease.
It's rare for young children, but nothing in healthcare is impossible.
Oh, okay.
Yes.
Thank you very much. But now, what are they genetical issues? Can they increase the chances of having the problem?
Those studies are still going on because as as in even the condition that predisposes you to get in a coronary artery disease or any disease of your blood vessels, akina diabetes, akina hypertension, and all those, we see that they tend to come in certain families.
Oh.
Yeah, so there could be some genetic connection, but first, the most important thing is to do what we can.
To save ourselves.
Yes, to save ourselves, even before we go to those deep issues. Because even if they are there, you find that they don't make the biggest percentage of the patients that
Yeah,
you
true.
Yeah.
Well, now let's assume I have the problem and I have come to the hospital.
Yes.
What measures or how do you diagnose I have this particular problem?
Okay, we take a very good history. First of all, we have to understand what has brought you here. And then there are some heart tests that we do,
Okay.
like here in our facility. One is called an ECG. It's a very basic test. It's just like when someone goes to a hospital akiwa na homa, kuna ile damu wanatumango inaitwa full hemogram, or unatumwa chest x-ray as the first tests. So even for us in heart space, ECG is a basic test. Actually, every person who is hypertensive, diabetic, they should have it done. Even those who smoke, even those who are over the age of 40, 45,
Oh.
because it's affordable and available. So I think what people need to know is that it is there, so they can be able to access it.
Okay.
Yes. And then after ECG, there is another one called an echocardiogram. An echocardiogram is an ultrasound. So those guys or those ladies who've ever been pregnant, when they were going to see their gyna or for their clinic, there were some tests that they used to be sent to check the baby.
Okay.
So it is the same machine, same concept, but now we are checking
Your
the heart.
heart.
Yes, so it's an ultrasound of the heart. That one is more advanced because we are able to look at the muscles, we are able to look at the valves, and and the big blood vessels that go and come out of the heart. So it's a very, very, very important test.
Okay.
And it helps us diagnose a lot of conditions, not just hypertensive heart diseases, even heart failures. That's the ultrasound test.
Well, unless everyone has an excuse ya kukataa kutritiwa ama kuangaliwa. Because I think here kila kitu iko hapa. Anything to test the heart. It's here within Embu.
Yes.
It's within reach.
It's within reach. Even there are some blood tests that can be done. It is within reach.
You just need to move.
You just need
Ukuje
to
hapa.
move. You just need to see your doctor. You just need to see a doctor. Let them take a good history. If they suspect that you have a heart condition, we have everything under one roof.
Well, that is very nice. And as I keep saying, you don't need to be sick to visit a doctor. Maintain your body, maintain your health, and ensure that you are doing fine and healthy. Daktari, unaweza tukumbusha jina and how to get to you in case someone out there wants something to do with the hospital ama to get a checkup. Ama hata mimi nijilete. So how can I get to you?
George Coronary Ikahu is my name. I am a cardiac clinician. Basically, those tests I was talking about, that is my bread and butter.
Oh, okay.
So I diagnose heart diseases. We treat them. We are at Mogo and Gatungo building, opposite the governor's office in Embu town.
Okay.
And our contacts are 0715 039 443. And you can also reach me on 0721 67 3529. And as I had also said,
Yeah.
we have both heart, adult and children heart doctors.
Oh, okay.
Because the conditions that are managed in children most of the time are quite different from adults. So,
Oh.
yeah.
So we don't use the same doctor to diagnose a child and an adult.
Most of the time.
Most of the time.
Yeah.
So,
Where there is availability of the resources. Yeah. You'd rather use the doctor who's supposed to take care of that condition.
Okay, thank you very much. I really enjoyed the show and I enjoyed the place. It's so beautiful and welcoming at that.
Thank you very much.
So I hope my audience out there, you are very, very much welcome. Sindio, tumewakaribisha wote. Mmekaribishwa nyinyi wote. And again, you don't need to be sick to see a doctor. Just come and confirm whether your heart is pumping right, you're breathing fine, and everything in your body is working just right. So this is the end of our show. Let's meet on our next show. I hope you enjoyed. So give us your feedback. But before I go, let me remind you again, whether you need sinks, showers, or toilet bowls, Pelezi Hardware, they are here just for you. And they are located along Kubukubu Road, just next to Blue Line. Tupatane kwenye next show. I'm Nyambura Kamau. This is the Health Hub Show. Lots of love.